Hey everybody, Peter, King Harvest, kingharvest.org. Probably wondering why I'm wearing gloves. I'm here to talk about microbiome restorative therapy, fecal transplants. So my vet, Dr. Margo Roman, she's a brilliant vet. She's in Hopkinton, Massachusetts. She runs MASH Vet, Main Street Animal Services of Hopkinton. And you know, she introduced the world's first fecal bank for dogs and cats. So she has serviced over 6,000 microbiomes. And so Microbiome Restorative Therapy, MBRT they call it, it helps with autoimmune, cancer, chronic dermatitis, GI issues, and much more. The donor dogs, she uses her own dogs as the donor dogs. They're organically, holistically raised for 5 generations, so 24 years. They've had limited vaccines, no antibiotics, no pesticides used on the home as far as, you know, chemical cleaners, no lawn chemicals. I've been to her house. She lives in a green home. It's great. So it's if 75% of the immune system, reading on the back, comes from the GI tract, then the microbiome needs to be front and center when seeking healing and health. This is the new frontier in medicine. MBRT treats many conditions. Here are just a few: cancer, IBD, chronic GI issues, allergies, autoimmune conditions, behavior. There's a connection between the gut and the brain. Our donors live in a loving, pesticide-free, chemical-free home yard, have never had any antibiotics, and are fed a homemade, raw, organic, and glyphosate-free diet. Our donors have had limited vaccinations, are titered regularly, and are screened for intestinal parasites. So, when you're giving the fecal transplant, you can take your dog to the vet. They can do it rectally with ozone too to complement. You can buy also bags of poop. So if you open, it's gross, I know. So you open my freezer. I have a whole bag of like feces just in this bag, in this individual, you know, gallon-sized bags. I take out one bag every couple days, and every day, Allie, come here. Every day I give her a little walnut-sized piece of poop, and I pop it down her throat. It's really gross, but it restores, so I'll explain in a minute. So Allie, here's Allie. Okay. I'm gonna show you how it's done. So this is what I do. Allie, sit. Good. So I just pop it over the mouth, I pop it down the throat, and done. That's it. All done. Okay, so tell you a little bit about Allie. So Allie, she's almost 10 years old, right? And she's acting like a puppy. You know, she's not really, she's a compromised animal. You know, she's not really, I wouldn't say she's healthy. She's doing as good as she can do because of all these different treatments we're doing. But, you know, I fed her grocery store kibble, fed her garbage for many, many years. Canned food, wet food. It wasn't good for her. She had really severe GI problems. She had, you know, chronic diarrhea, bloody diarrhea. You know, she was always getting, you know, illnesses like kennel cough or the flu. She was very susceptible to disease and illness because her gut was not healthy, and that makes you, and your immune system is down, it makes you more susceptible to getting stuff. And so, you know, her behavior was not good. She looked very sickly. She was losing weight. I overgave her antibiotics. Every time she had diarrhea, I would bring her to the vet, and which was, you know, every week just about, and they'd put her on metronidazole, which is it's an anti-diarrheal. It's an antibiotic, okay, and it's used as a quick fix for diarrhea. And, you know, it stopped the diarrhea in its tracks within a day or two, but once we stopped the medication, the diarrhea would come back. So it band-aids the issue, but it doesn't solve the underlying cause, and the underlying cause is in our guts. 85% of our immune system is our gut. That's where health begins. So I was giving her this antibiotic every week, overusing it over and over and over and over for many, many years. Wasn't getting any results. She was getting sicker and sicker. And what my vet didn't tell me at the time, this was a vet, my old vet, my first vet, he was a conventional vet. I ran out of there as fast as I could once I learned what he was doing. He never recommended that I ever put Allie on a probiotic. So I'm giving my dog an antibiotic. It doesn't discriminate. It kills all the good bacteria, kills all the bad bacteria. And what am I doing to restore the good bacteria that's lost when I give this antibiotic? He never told me to put my dog on a probiotic. He sure as hell didn't talk about prebiotics. The food that feeds those probiotics is very, very important, pre and probiotics. So I'm giving RX Biotic. It's a synthetic probiotic mix formulated by veterinarian Dr. Robert Silver. So I like that a lot. I give her 2 to 4 scoops a day in her meals. I'm also giving Allie raw, unpasteurized milk. Okay, and there's a lot of good beneficial bacteria in raw unpasteurized milk. It's really good for you. And when it was out in the news a couple years ago that Maggie, a 31-year-old dog from Australia, how she lived to be that long, we really have no idea, but all the evidence, all the clues are there. Her owner was giving her a cup of raw unpasteurized milk. This is the dog that lives in Australia on a dairy farm, and she was getting a cup of raw milk in the morning and a cup at night every day her entire life. So, the dog was eating poop on the farm too, from the horses, from the cows, and the goats and the sheep and all that. There was all this bacteria and the good beneficial bacteria in the poop, in the milk, that was populating her gut, and promoting a healthy gut and immune system, digestive tract. So there you go. And so we're using the Microbiome Restorative Therapy to restore the gut health that we lost through improper diet, kibble, overuse of antibiotics, over vaccinating, which is a huge issue, flea and tick pesticides, house, chemical cleaners. Those are all things that damaged her gut and her immune system and compromised it, and why she got as sick as she did. So I'm doing all I can to help restore that gut. The gut is everything. So hope this video is helpful. Check out MASH Vet, MASHVET, mashvet.com. This is the fecal bank card that I got from them. It tells you all about it. Dr. Roman is an amazing vet. She's a brilliant woman. She's doing a lot of cutting edge therapies, holistic therapies that are, for cancer patients, for dogs with IBD and other autoimmune issues. So most dogs today are compromised in some form. 96% of dogs are on kibble, processed food, highly processed food, that's not species appropriate, and it's damaging their immune system. Maybe over time, maybe not right away, they're not presenting as sick, but over time and low gradual doses, exposures to these things, these harmful things in the environment and lifestyle, really add up over time and result in cancer. Species appropriate diet, you wouldn't feed an earthworm nectar and you wouldn't feed a hummingbird dirt. An earthworm, a species appropriate diet for an earthworm is dirt. A species appropriate diet for a hummingbird is nectar. You wouldn't swap that. They'd simply die. But dogs and cats are a bit different. They're meat eaters, they're carnivores, and so they thrive on meat. But then also today you've got the issue of, the soil. The soil is deficient. Most soil today is deficient, so your meats and your veggies that you're growing, you're seeing, are deficient in a lot of vitamins and minerals, such as selenium, which is why I feed Brazil nuts. Okay? And it's important that the Brazil nuts are from Brazil, because that's where the selenium, they have high amounts of selenium in the soil. So just check the sourcing. Sourcing is very important. If you can afford grass-fed, if you can afford pasture-raised, always go with that. All right, hope this helps. Bye.